Okay, everybody, thanks for being here. I've got the distinct pleasure to introduce Dr. Becky Natrajan. She is a board certified internist and gastroenterologist. She's practiced gastroenterology in Tucson, Arizona for many, many years. And Dr. Becky transitioned to holistic and nutritional approaches to care for her patients. And she became senior medical director of a formidable network marketing company that focused on cleansing and replenishing the body. Dr. Becky helped take that company from $19 million in its first 8 months to $1 billion in sales in just 5 years. Success leaves clues. Get ready to take great notes. She's spoken internationally on how to heal the body through nutrition and allowing your body to become the miracle it was always meant to be. So, Dr. Becky, thanks for joining us, and please take it away.
Thank you so much to you and Michael. Always an honor to be here. So, of course, being a gastroenterologist, we're going to talk about the microbiome tonight because it is my favorite subject. Microbiome in Greek means tiny life. And we have these trillions of organisms that live within our gut called the microbiome. But, I'm going to start off with a story first because this story about somebody I met with for lunch the other day kind of pulls everything together about why the microbiome is so important, because the microbiome is responsible for pretty much your entire systemic health. Your gut, if it's happy, then you're pretty much not just happy mentally, but overall your body systemically is in balance. So I met with a lady the other day. She's in her 50s, like early 50s, and she's looking for a nutritional approach to help with her gut, to help with serious problems that she recently experienced. And years ago, she had a gastric bypass. And if you know anything about what they do, is they create a gastric pouch, like a small little pouch, and then they basically suture off the rest of the stomach. And then they pull the second portion of your small intestine to attach it to that little gastric pouch. So she had it many years ago, and she did lose weight, but over the years, she was gaining it back, which I would say of all the people I know that have had gastric bypass, 9 out of 10 are back to obesity. It's really a shame. So she was gaining weight, and all of a sudden, hips are hurting, knees are hurting, hard to walk, very uncomfortable. She got inflammation everywhere. So she starts popping Aleve like they're Skittles. And one night she wakes up in the middle of the night very nauseated. And when she did vomit, she vomited blood. So these are the kinds of calls I used to receive when I was on call as a GI physician. Usually 2 o'clock, 3 o'clock in the morning, I'd get that call. 52-year-old female, history of gastric bypass, taking non-steroidals, puking blood. I'm like, oh, here we go. So she goes to the emergency room, and of course they do a look called an upper endoscopy, which I did tons of those. And it's scary when someone's actively bleeding because their blood pressure is not stable. You're giving them blood, you're giving them fluids, you're trying to stabilize, you still have to sedate them. So it becomes a nightmare. And she did have an active bleeding ulcer right at the hookup site between the stomach and that small intestine where they did surgery many, many years ago. So they were able to stop the bleeding just by cauterizing it. But she spent almost a month in the hospital because she couldn't eat. The ulceration was causing swelling, so nothing would pass through that gastric pouch. She required a feeding tube into her small intestine. And in 4 months, she dropped 100 pounds the wrong way. So I'm sitting across from her and we're talking, and she just looks horrible. I mean, the color's gone from her face. She's just, skin is sagging, looks depressed, but also very anxious at the same time. And I'm just thinking, gosh, her microbiome is so screwed up. And it was really screwed up because they also gave her a lot of IV antibiotics when she was in the hospital for various reasons, including an infection in her stomach called Helicobacter pylori, H. pylori. So they pumping her with the antibiotics and all these other drugs. And now she's lost 100 pounds and she's completely nutritionally bankrupt. She's depressed. She's anxious. She has still inflammation throughout her body. Her adrenal glands are not working well. Her endocrine system shutting down. Her immune system shutting down. Everything that's linked to the microbiome is shutting down. So the reason I talk about this particular story is because she is the antithesis of when your microbiome is destroyed and you are nutritionally bankrupt and we're all toxic, then the body just starts to fall apart. So why do we support the microbiome, and what did I recommend for her? Well, she's able to eat small portions. Okay, she still has some narrowing between the stomach and the small intestine where that ulceration has healed, but they need to go in and stretch it endoscopically on a regular basis. So she can eat some foods, but mainly a soft diet. Well, we know her microbiome is destroyed. And if your microbiome is not functioning and you start to fall apart, you've got to replenish. So she needs to be on the reds. She needs to be on the greens. She needs all these servings of fruits and vegetables because they're prebiotics. Prebiotics mean before. So what microbiome she does have, we need to create more healthy active microbiome by giving her prebiotics. And what better than fruits and greens to mix up in an alkaline shake every morning? So Asante is so perfect for her because she's exhibiting all the signs of a very sick microbiome. Her brain chemistry is really off. I mean, you can tell she's depressed, but when she speaks, she's incredibly anxious. Well, that's another sign that the microbiome and the gut are not connecting. The gut and the microbiome, that gut brain connection is that superhighway that needs to be supported. And once your gut microbiome is good and it's happy and it's healthy, then the anxiety is going to calm down. The depression is going to lift. Your focus is going to be more clear. You're going to sleep better. You're going to have better rest and better energy. So recommended the fruits and the greens. And then, of course, the probiotics. So we've got prebiotics on board, along with the fact that she's getting all the minerals and the vitamins. And then she needs to be on the probiotics because these are active cultures that get in there and support more healthy, happy microbiome. So she needs those prebiotics. She needs those probiotics. But I guarantee she's got biofilm sitting in the intestines. And what biofilm is it's like a slime that covers these colonies of bad microbiome. It's like they get into these colonies, the slime goes on top of them, and then they fester and they fester and they grow and they grow, and it creates more havoc internally and systemically. It can also cause the gut to be very leaky. So we have PhytoCleanse that rids the body of that biofilm. So it allows that bad bacteria to get out of there. And mainly, microbiome is mostly bacterial, colonies. You can still have fungus and you can have viruses and you can have other things, but it's mostly bacterial. But if you have biofilm encasing a section of bad colonies of microbiome, then they can cause penetration and loosening of the junctions in the intestinal tract and cause something called leaky gut syndrome, which is just a huge term for now we're going to set up inflammation in the body. The inflammatory cascade is on fire now. So aches and pains and arthritic issues and skin issues and all kinds of issues are going to start to happen, including more weight gain and visceral fat, type 2 diabetes, hypertension, high cholesterol, everything that's associated with something called a metabolic syndrome. She's exhibiting everything. I mean, she had the weight loss, but she was sick as a dog for 4 months. That weight loss just made her nutritionally bankrupt. And again, we're all toxic, and she was the epitome of toxic with no good microbiome. So I recommended the fruits and the greens, and of course the probiotics and the PhytoCleanse. And she's going to get a Go Green pack because that's exactly what she needs with all of these products. B tabs. She can suck on these little B tabs to allow for more nutrients to come into her body to strengthen the immune system. And then because of her age, and as we age, our exocrine pancreatic function declines. You may see commercials on TV. EPI, I love these commercials because all the drug companies want to label everything as a disease. So then they can put a drug to combat the disease they just invented. So if you've seen commercials for EPI, it's exocrine pancreatic insufficiency. That's what happens when we get older. As we age, our pancreas starts to slow down with the production of digestive enzymes. It doesn't need an acronym. It doesn't need the symbols EPI, and we can give you a drug. What you need is daily digest. And you need it regularly before your meals and your snacks and at nighttime, because it will boost your immunity even more than you think, not just through the microbiome being healthy, but it increases T cell proliferation, which is a major part of our immune system and fighting off infection. So she was just the perfect candidate for everything that we offer. And I told her how to take everything. I told her why she needed to take everything. Because she not only, we know that microbiome is bad and she's got inflammation and leaky gut and a bad brain chemistry, bad immune system and endocrine system, but her adrenal glands were completely shot too. And the gut is connected to all of these systems I'm talking about. The gut's connected to liver and detoxification. The gut is linked to cardiac function and cardiac output. It's also linked to healthy or non-healthy lungs, depending on your microbiome. Same with your kidney function, same with your skin. So when we talk about the microbiome and supporting it with all organic plant-based products from Isante Organics, we're talking about getting your whole health systemically back into balance so everything can work in harmony and synergy. And I can't wait to share her story as she makes this journey with these products to just see exactly what happens with her. Because at this point, I mean, if she doesn't start these products, I don't have anything to recommend. I just don't. So she is just the epitome of what happens when that microbiome is completely shot. So, for all of you on the line, ladies and gentlemen, I'm sure you know people that have some gut issues, gas, bloat, distension, pain, alternation in bowel pattern. That's irritable bowel. That was the number one thing I saw in my practice every single day without fail. But unfortunately, second on the list was inflammatory bowel, where the bowels get inflamed. And that's a really bad setup because you've got to support the microbiome no matter what with inflammatory and irritable bowel, two different syndromes. Irritable bowel is mainly microbiome gone bad with motility gone bad, whereas the inflammation cascade with inflammatory bowel disease, not only is the microbiome sick, but you've got a bad leaky gut that's causing inflammation everywhere in your body. Because if you're diagnosed with ulcerative colitis or Crohn's disease, two of the inflammatory bowel disorders, it's a systemic disease. You get arthritic issues. You get the true brain fog. You get kidney stones. You have a sluggish liver, something called fatty liver, steatohepatitis. It's systemic. It can affect the eyes. So when you have that diagnosis, you have to understand it is affecting the whole body. Irritable bowel, a little bit easier in terms of it doesn't, seep in inflammation into the body like inflammatory conditions like ulcerative colitis and Crohn's disease. So to me, she needs to be waking up every morning and having one of Isante Organics alkaline shakes, because alkalinization is great for the body. You balance that pH, you help to fight off inflammation, infections, etc. And you add a scoop of the reds and a scoop of the greens, and then you take your digestive enzymes before, your probiotics before, and then at night you do your phyto cleanse. And during the day, you can take and suck on as many B tabs as you want. I mean, this is a program that will really help this woman. But for all of you on this call, there's a lot of people out there that need your help. They need our help. They need to have the microbiome fixed. They need to get their systemic health back in order, and they need to live a great quality of life, because as we age, certain things do decline, including that pancreatic enzyme production, like I talked about. So don't go and listen to the TV that you need a drug for EPI. You need digestive enzymes from Isante, because as we age, our exocrine pancreatic function declines, where you're not producing enough enzymes. And if you're a meat eater, and I'm not, I'm almost 95% vegetarian at this point. I have a little bit of chicken once in a while. But if you're a meat eater, you need enzymes yesterday, because your body is not processing, it's not digesting, assimilating, and absorbing properly. So you have more chance of getting inflammatory conditions as a setup in your body. So I am just excited that we have products that can change lives on such a physiologic level. And it all makes clinical sense to me, understanding the gut and the microbiome and everything it's connected to. So we should be out there sharing this message, because going green is the best thing. And I'm going green, and who's coming with me? So thank you, Michael, and thank you, Dr. JJ. Again, always an honor. And so I'll leave it up to you, whatever you'd like to say at this point.
Thank you. Thank you very much, Dr. Becky. And guys, Dr. Becky does jump on these things, and we're very scheduled, meaning that on Tuesday nights we talk a little bit about, we talk about the business. That's what it's about. It's a business, overview. And then on Thursdays, we do all these different types of education. And, one thing I do want to ask you, Dr. Becky, because somebody's new on here, and when you don't have a gallbladder, like somebody gets their gallbladder, I think enzymes are extremely important in that situation, because that's a pretty, unfortunately, it's a pretty common thing. People get their gallbladders taken out.
Yes.
So what would you say about that?
Well, I mean, a couple of things with the gallbladder. Basically, the gallbladder that sits, underneath the liver on the right side, and it's a reservoir for bile. And so your liver produces bile. It travels down this little tubule into the gallbladder. And then when you're eating, especially if you're eating fats, the gallbladder will contract to allow for bile to empty into the small intestine to help your digestion. So more times than not, when I was in practice and somebody had their gallbladder removed, they would get something called bile acid dumping, where if they had a fatty meal, there was no reservoir there to allow for the proper release of bile in increments. The bile will just shoot out. And so it's a cathartic issue, meaning that the bile causes a lot of loose stools immediately because it rushes through the small intestine, it gets into the large intestine, and then it just starts pulling water and you evacuate like crazy. So bile acid dumping usually would equal pretty significant diarrhea. So from a diet standpoint, you have to really watch your fat intake, especially post cholecystectomy, post gallbladder removal. Something though that really helps is if you're on a high protein diet. So if you're doing the alkaline shakes and you can add the reds and greens to it and use that first thing in the morning, you should not experience such severe bile acid dumping. It usually takes a while before the liver starts to accommodate the fact that the gallbladder is missing. So it recognizes we don't have that reservoir, I'm dumping bile, but if you start to retrain your bowels, and you can do it with our products easily, then definitely the shake, the reds and the greens, and the shake is very absorptive. And plus, if you're having some bile acid dumping, it's going to be less because of your increased protein intake and decreased fat intake. So those would be like mainstays. And then the digestive enzymes, of course, because you want to be absorbing, okay, not dumping. So that's really important before meals. And avoiding that fat, again, is very important. Now, the phytocleanse, all of us have some biofilm in our intestinal tract. So at some point you can add in that phytocleanse. You just don't want to potentiate potentially more loose stools. So you want to get the bile acid dumping under control before you add in the phytocleanse. And of course you could do the probiotics, no problem. But hopefully that makes sense. But I did see a lot of post gallbladder bile acid dumping, and then it was very discouraging. And there is a drug that you can give for that called cholestyramine, but we have the natural drug to help with that. So hopefully that answers your question.
Thank you. That was a phenomenal answer. Very fascinating subject. So I appreciate the question as well as the great answer. Dr. Becky, we so appreciate you. This was an excellent call. I know everybody took great notes. And for those that are watching this either live or on the replay, everything that Dr. Becky recommended, we have for you. We've got the full Perfect Gut Health nutritional line. So Dr. Becky and all of us here at Asante Organics, we are excited to help you. And we look forward to seeing everybody on the next Zoom. Bye-bye, everybody.
Thank you. Thanks.
Thank you.